So here it is, Wednesday morning, I think it is. Wednesday, and I'm with Jazzy right over there. And myself and Jazzy are heading over to see Dr. CullenWebb, CullenWebb Eye Specialists here in Moncton, New Brunswick. I brought Jazzy all the way from Los Angeles because I heard about this doctor. She's amazing. So we're gonna go see if these eyes can have some work done. My hope is that they'll say at least one. So we're gonna go see the doctor and see what she has to say. Very excited.
You made it?
We did.
Found this pretty easy?
Oh yeah.
Hi, how are you? She's a girl.
So nice to meet you.
I'm Cheryl.
I'm
Nice to
Sean.
meet you.
Can you tell me exactly what a cataract is?
Cataract, when you look at it, is something whitish blue in the center of the eye and the lens. I'll get my little eyeball out if that's all right.
Oh yeah, that's great.
This is the lens that would sit in the pupil of the eye, and it's important for focusing. In a cataract patient, if they have a complete, or what we call a mature cataract, it turns completely white.
So basically the lens turns white.
Right. The inside of the lens. And if you think about it like a Smartie, the candy coating of the Smartie would be what we call the lens sac or lens capsule. And inside turns white. With time, as the cataract will get worse, then that lens sac can get covered in cataract too, which isn't great for surgery because we want to have a clear lens sac. Because when we do surgery, we'll make a hole in the lens sac and ultrasonically suck out the white cataract, and then there's a white sac.
Right.
To hold an artificial lens.
Right.
So one way of looking at it, this is like the typical protein in the lens is clear, like an uncooked egg white, and this is a cooked egg white.
Right.
And I mean, you can't see through that.
Right.
Therefore, the lens isn't doing what you want, and it's blocking your vision because your retina and the nerve are back here. And if you can't get information clearly through the windshield of the eye, through the lens to the back, then you can't see.
You can't see. How similar is it to the ones that humans have?
It's identical in terms of phacoemulsification. It's the same unit. Like when we moved here 5 years ago, we had a newer cataract machine than the Moncton Hospital did.
Yeah.
So we use the same machine. We use a little bit of tweaking with the different types of instruments. I mean, the dog lens is way bigger than a human. Like if you look at our eyes and their eyes. So the needles that we use are a little bit different. They're geared more towards the dog. But we buy the products from a human company, we do have to use different lens implants for the dog. It's a different size lens than what we'd have, but yeah, it's the exact same.
I mean, here I am bringing my dog from Los Angeles to come see you. I'm sure there's lots of options there, but you know what? I just feel comfortable. Maybe it's just the Maritimer in me and the Canadian healthcare system. There just seems to be more of a comfort for me.
So today, my plan will be to do some of the same tests you appreciated with Dr. Kropp. So tear checking and pressure testing and whatnot. Then we'll put a drop in to dilate her pupils, which will take about a 20 to 30 minute period to kick in. The importance of that will be to evaluate the extent of her cataracts and see if I can look around them and look at the back of either eye. Good job.
Good deal. So doctor, if you could just give me a brief, what was the test we just did with Jazzy?
We did electroretinography or ERG, and we ultrasounded her eyes.
Right.
So Dr. Webb's going to talk about the ERG results.
So really this is just a graphical response of how her retina is functioning. So after sitting in the dark for 20 minutes, so this little dot here represents the baseline, and this represents the A wave or the negative deflection, followed by the B wave or the positive deflection, giving us an indication of her overall photoreceptor function, so the back of her retina, the part that accepts the light and converts it into electricity. And what we're looking for is the height between this negative deflection and this to be greater than 100 microvolts. And you can see here, this is her left eye, and this over here is her right eye, and you can see left eye, the A to B amplitude is 159 microvolts, and for the right eye is 148 microvolts. So
they're both above.
So so that indicates that she has good, appropriate, and acceptable retinal function for surgery.
And then these are some of the ultrasound pictures that we took. So the probe that we had on her eye, this would be like the surface of her eye or the windshield of her eye. the
Okay, so
cornea.
that's the front.
That's the front, and then kind of the chamber with fluid in it. This whitish kind of UFO looking
lens.
thing, that's the lens. And in a dog without cataract, we see a faint white line here and a faint white line there indicating the lens. But because she has cataract, we see all that white stuff. And of course, we didn't need to ultrasound her eyes to know she had cataracts. But what we were most interested in is what's going on beyond the cataract. And so all this area here that's mainly black, that is made up of mostly water, because ultrasound will be mainly black with water. So that's the gel, or what we call the vitreous humor, in the back of her eye. See these little white flecks? She does have a few floaters, or what we call vitreous degeneration, which is common in small breed dogs. Not a ton. I mean, some dogs, there's just kind of a snowstorm back there. So she has a few. We were looking also to see if she had a partially detached retina. Because you can have normal retinal function if half of your retina's off.
Right.
So what we look for there is it would typically look like a white line coming up from the back of her eye forward into the gel if it was partially detached. And we didn't see any evidence of that.
Right.
We are very pleased with what she has tolerated. We did everything that we had hoped to accomplish today. We're happy with her eye pressures and tears and retinal function and the state of her eyes. So I think if you're interested in surgery, I mean, it's a matter of coming up with a time that would work for everybody.
You know, we'll talk about schedules and stuff. But so given where we're at, you say yes, everything's looking good for surgery.
Yes.
Okay, well that's great. I'm happy to hear. Jazzy, did you hear that? You're good for surgery. You're a good candidate. Yeah, I can start. I'm starting to smell her now. So.
Oh, are you?
It's gonna be a long drive home.
Next time you'll be like,
windows open. No, I don't mind. I got it. That's Boston, as you know.
Yes, yeah.
Are you a good candidate for surgery? Yeah, you